I'm Brian Manswood. I'm with the Fire Marshal's office. We have Greg Otto. He's president of the fire department. Lisa Camp is the EMS chief. We also have Mo Cabrera, our city managers, will be here as well. So these folks can help answer any questions that I may not be able to answer tonight as we go through the presentation. If you bear with me as we go through, have a little bit of a brief history about why we're here today and why we're going in the building. Feel free to ask any questions you may have as we go, but if they're not specifically on the slide, give me a couple more slides. I may get to them as well. So some of the contributing factors we have that lead us to the discussion or lead us going into billing is the increased call volume. So over the years, our population increase for the city and our median age has increased, and so as our call volume has increased. For that, also we need more ambulances. Currently, we only really staff one ambulance. Over the years, it's been primarily with volunteers. Over the years, it's been more and more part-time, and we need to go to full-time employees that can be here to answer those multiple calls that we have every day, and also eventually, hopefully, eventually soon, to go to staffing for 2 ambulances. With that, and I kind of mentioned it, the increase for paying those that are working for EMS. Volunteers, it's an impact on them. You have 1 call a day. You're able to answer, go to that from your house. But then when you have 4 calls, or we have these back-to-back calls, they're not able to do that. Someone has to man that ambulance all the time, 24/7, and that's not really an impact that we can that's contributing to our volunteers. So leading more towards a paid program. And then also with that, with the increase and us not having them, we were having to rely more on mutual aid. So we don't want to be bad neighbors, and also that creates a regional impact when you take an ambulance from another community and then they all of a sudden have an issue and they're taking it from another community and it steals around from everybody else, and increases those times, the time responses if people really need an ambulance. So we don't want to be that either. Just some graphs. If you notice over the years, last 10 years, our response volume has increased. The median population age has also increased, increase in our call volume, and also our population growth as well. Some timelines. This is not something that happened overnight. This is not something that we knew it was something that was increasing. We've been watching the trends. The fire department have made sure that we've been communicating with the city staff and also with council. So these discussions have been going on. In 2017, the council basically they helped come up with some solutions. They established a subcommittee. In July of 2017, that subcommittee came back and presented their findings to council. And then council went out for RFP for our EMS service to see if we were getting the best service for the community of Friendswood. June of 2018, we went out for the RFP for our medical billing, our billing and collections. And then just this last week, we did the second reading to establish ordinance for our fees. And then we're on track to start billing January 1st. So Friendswood EMS has had a long-standing contract. It's been providing EMS. I know we're in the currently right now in a contract, and that contract's been renewed for another year for them to keep going with EMS service, and also past that. And we'll go a little more into that in a second. And then also Emergicon was awarded the contract for our EMS billing. And I failed to also let you know that Emergicon is here as well, so if we have any questions that I can't answer or anybody else, that they can help us with those questions as well. For our emergency medical services, we do have the contract with the volunteer fire department. That we are in a current 15-year contract with the city with the fire department for both fire and EMS. That contract was amended for this last year to allow us to go into to have billing. That was something that was in that contract. And then when that contract expires at the end of next year, we're in the current contract negotiations to renew that contract based on the RFP. It was been authorized by council, and then that will the fire marshal's office. Main reason why I'm up here doing the talking is because we're helping doing the administration for both the Emergicon contract and the VFD contract. Some of the things going forward, some of the things that this brings to the table is the 2 full-time ambulances. That will be towards the end of the fiscal year, somewhere late summer of 2019. Going into next year, we'll be able to establish that with the new contract, and also with the revenues coming in for us to establish having 2 ambulances servicing the city of Friendswood, and that would put us with if we need it, they have the ability to bring out that 3rd as well if we need it. So that gives us increased coverages as well. Right now they're operating out of Station 1, and they will have 1 operating out of Station 1 and the other on the other side of town out of Station 4. It's the one on the 2351 corridor. And they'll be able to maintain the service they've been maintaining for a long time to the city. We'll have a full-time supervisor. They'll have full-time paramedics per unit, and subsidize that staff with as we kind of transition with part-time employees, and also still utilizing our volunteers. And the implementation of those revenues, the billing, will help us with that. The VFD is going to be the one holding the state license, the whole Medicare and Medicaid licensing for billing, and they also have the agreements with our medical director, and they're the ones establishing the protocols. So Emergicon, we have the agreement with Emergicon to do the medical billing. So they'll help us with the billing and collection pieces. They're going to be the main point of contact for patient inquiries. And once again, that'll also be administered by a representative from the Fire Marshal's office for the city of Friendswood. Now you kind of see, this is what the base rates that were established by ordinance for. This is also, and I have another slide, but this is kind of in par with what the region's doing, or our neighbors. Basic life support, so our transports, just our disposable fees, we're going to do a flat rate for disposables, oxygen, treat no transport. The question was if you would get multiple in terms of basic life support, advanced life support, advanced life support. No, it'll be one of those 3 based on the level of care provided. I think Brian will talk and demonstrate those levels in the next slide. And that's what we're going to go on this, is we have our basic life support, just a ground transport with some basic assessments, and then the advanced life support. That's so like the question was, is that it's a different stage. If more protocols are needed, or if more interventions are needed, then that will be required to go up to another level. Just because we have the paramedics on there doesn't mean that we automatically get the bill because the paramedics are on there as an advance or an advance 2. It actually requires those interventions to happen before we can do to that point. Lift assist. We're not charging for a lift assist, and that goes right into and I'll skip over to the treat no transport. So we get our goal is if you get a phone call, third-party call, someone calls for you, and not something that you're really interested in, refusal, whatever, just because you refuse to come out, there won't be a call for that. There's got to be certain interventions that happen before you get the treat no transport charge. A handful of things that have to happen before that, and you see that where the badging, so a lot of those things are the things that can happen and you won't get the call for, but you go above those things and then you'll get the treat no transport call. Just to clarify and add a little bit more to that, and Chief Camp, correct me if I'm wrong, but if you have a situation where there's an auto wreck and PD requests medics because they're uncertain, that would fall under a non-billable call, something like that, where we don't make patient contact, or if we do basic vitals and do a quick assessment, those would all fall under a non-billable call. So it's going after specifically requested services.
What's the difference between a treat no transport and a lift assist? So basically a treat no transport, you have to have something done beyond bandaging, splinting, pulse oximetry, and a blood glucose check. So if I put you on the monitor, if I do a 12 lead, I look at your heart, I put you on oxygen, I give you some medication, and then you say, look, I feel better, I don't want to go to the hospital. I'll say over and over again, you need to go to the hospital, and you say, no, I'm not going, I feel better. Then that would generate a treat no transport charge because we've provided service beyond some basic skills. So that, but if I come out and you don't want to go to the hospital and I take your blood pressure and you're fine, you won't get a charge for that. So I have to go above these things. So we made a list of criteria: blood pressure, bandaging, splinting, a pulse oximetry check, and one blood glucose check. And then we thought it was a fair assessment. We could also take care of the people, you know, that may be at the PD that need to be checked too, without creating a lot of charges. But if I go to the next level, say I need to look at your heart rate on the EKG monitor, I need to do a 12 lead to rule out something, and I'm telling you need to go to the hospital, and you're just like, I don't want to go to the hospital, you will get a bill for that service. But if I go out to a wreck or your house, you want me to check your blood pressure, you want me to see what your oxygen level is from a pulse oximetry reading, you want me to check your blood sugar, and you're fine and you don't want to go to the hospital, then you won't get a charge.
So just kind of an idea of what some of our neighbors are doing, basically, is where we fall into that. Averages were taken on a lot of these to help determine where we would fall. To date, just to know, since we are rolling out billing, and because we kind of talked about before, we only have one ambulance, so we're started seeing that we were calling more and more ambulances from our neighbors. Well, this is the kind of charges you were getting from our neighbors if you made that call and we weren't available and we had to call mutual aid in. This doesn't take in effect any of insurances or other commercial payers or anything. This is just an idea. Is that if you look at some of the things like Lisa said, she said oxygen and the treat no transport. Well, then that would be an example for that situation. This is an example of what possibly you could see if you had an advanced life support type call. They had to push some medications, probably 12 lead type stuff. Those are your disposables. That's something that could be what overall, not including what the third party payer or commercial payer or anybody else would pay, but just overall what a bill could be.
So who decides if the patient needs oxygen? The medic will decide based on the protocols written by the medical director how the patient falls into the treatment categories.
So the patient can refuse it, right?
He could refuse it, absolutely. And they'll have to sign a refusal that says they were told the inherent risk of refusing a treatment. And they can refuse it, and then, yes, there would not be a charge.
Different insurances are going to pay different amounts. It depends on your policy. It depends, Aetna. It depends on Blue Cross Blue Shield versus Medicare or Medicaid. Medicaid is going to pay the least. Medicare pays a little bit more, but it's down there too. Your private insurances are going to pay more of that bill, of that 17, whatever it was. They're gonna eat up more of that, and it's also going to depend on your deductible. Most people have higher deductible plans now, so if you've met your deductible, some of them will pay 100%. There is no in-network and out-of-network for EMS. There's no such thing as that because there just isn't. So everybody is, in-network, if you would.
So the no collection means is that the city. So he talked about the balances on this. So say your insurance did pay 80% and you owe 20. So you may see a bill that comes to your house for that 20%. And you may get it a couple of times. Those that are familiar with it, you may get the 30 days. This is a 60-day window and the 90-day window, which is typical. We encourage you to pay that because that's how we're going to try to keep EMS going, EMS service going. However, we don't plan on going to your collections agency and having it negatively affect your credit or anything like that. And those phone calls that keep coming in, that's not the point. The point for the city is to try to get as much revenue as we can on the commercial payers, and yes, we're going to let you know what you owe. But a couple of things is if you do owe and you need the EMS service, please call us because we're going to come and we're going to service y'all. If you need help, please call us. And we also don't want to get into where it's like, was this going to cost me before I need it? We want to provide service for those that need it, medical service. We want to make sure that you get the medical attention you need. And maybe some of those interventions happen at the hospital when you're there, when you have stuff but when you're in an emergency type situation, you usually don't go, okay, is this going to cost me before I have it? and they're not going to give you stuff that you don't need. They're going to try to make sure that you're safe, make sure you get where you need to be, and get you the best help you need. So that's the goal for everything. And then on our end, we have to sustain EMS service without going to billing. That's going to be a difficult task. So that's why we're going this route. So the question is how does the city cover the part that we're now pursuing out of collections?
So right now, 90+% of the citizens in Friendswood have insurance. You pay a premium every month to have coverage in case something were to happen to you. This billing will be collected predominantly from your insurance provider, which brings in substantially more revenue than what the city is currently receiving on EMS services. So the smaller...
So if you got 80%, then the city can live with that.
Well, the city right now is living at 100% subsidizing EMS services. So you're paying through your property taxes and through sales taxes and any general revenue fund. But your insurance premium is still the same today as it will be tomorrow once we start billing. Does that help? Well, I would prefer to collect 100%, but I don't want to discourage folks from calling 911 when they need help. Well, the donations only go to cover capital equipment, fire engines, ambulances, so on and so forth. So they never went towards operational costs. So just to give you some perspective, in the last 12 years, we've gone from, and we appreciate the volunteer fire department to the zillionth degree, because these are dedicated men and women of Friendswood that put their lives on the line responding to our calls. But their costs are going up it's out of their hands. The cost of providing the service is a factor that they can't control. The cost of trying to secure more volunteers is a factor they can't control. So over the last 12 years, we've gone for both fire and EMS services from roughly $800,000 a year to the city's budget to over $1.6 million a year. But we haven't increased any revenue source except for your taxes. And you continue to pay your private insurances premiums to cover a service that they're not obligated to fund.
So what you have here is an example of what you may see for a bill, your part. So this is after, obviously, your insurance paid their piece. So this one makes an assumption that Blue Cross Blue Shield here had their share, they're paid, and that's the remnants that you may see, kind of what the young man asked about earlier. So that's what you may see at the house. Come to you, and that's the out-of-pocket expense that we'll be asking you to pay to help support the system. One thing you will get, your family member or whatever that's with you may get one of these from the EMS technicians or the paramedic technicians that are out there after your service, because Emergicon is going to be your point of contact, so you'll get some information. So if you have questions about what my bill may be, how it's processed, what do I do next, you'll have that information, okay? After you have the service. So they'll have those on the ambulances, and after your service, it'll be given to, family member or whoever's with you, so that you have, or if you're, depending on your situation, if you're able to get it, then they'll give it to you. So the donations does provide revenue, but those are specifically for capital items. So that's our fire trucks, our ambulances, our rolling stock, and some of our tools for specifically those vehicles that get them operational and running. Okay? But we still need those donations for that. Like city manager said, we're still just subsidizing part of the cost with the EMS revenue coming in, the revenue coming in for billing, and we still need that to help with the cost for the rolling stock. It doesn't even cover the whole need there. The donations we get do not cover the whole need. So it supports the fire and EMS capital fund. That's the big heavy equipment, and EMS billing is only a portion that help offsets that. So it's not going to cover all the needs. It's a big piece of the pie that's there needed to sustain this operation, and we're just looking for pieces to help offset it. So the question is, how many volunteer medics do we have?
Currently, we have about 42 volunteer medics and about 20 part-time paid and 3 full-time supervisors.
Overall, the volunteer fire department has about 85 volunteers that are either in the fire division, EMS division, and probably about a dozen that are what we classify as dual members that participate in both divisions.
Same protocols. If you don't have insurance at all, you'll get a bill. Emergicon has been given information if you can make payments or if you can pay up front. They're able to negotiate a little bit. They have some ability to do that for you to pay out of pocket if for some reason you don't have insurance. Once again, if for some reason you need us again and you haven't paid, we're coming. We're not going to show up at your front door or anything like that, or negatively affect your credit or your care.
One other question I would like to help you guys with, especially our over 55 population, is Medicare. So Medicare has a set amount that they will pay. So the difference between what Medicare pays and the 20% that you will be billed for, you won't make up the difference. Because Medicare is going to pay about $462 and then about $725 maybe for mileage. So then you'll only be responsible for the remaining balance, not the amount that we have to adjust off. So if it's a $1,700 bill, say Medicare pays $500, you're only going to be 20% of $500. So you're not going to have to make up the difference between the $1,700 and the $500. Does that make sense? So and that's exactly, we do the same thing like you do at the hospitals and your doctor's office now when you get a bill. You don't get the whole bill, you get what they've negotiated and agreed upon as a cost that they will pay you. And insurance is the same way, just what Brant was saying earlier. It's hard to say because your network, your insurance is all negotiate different amounts. And so it's hard to say until we look at your individual insurance what your cost will be, but you will never make the difference up between what they actually pay and the total bill. You'll always just pay your 20% or your 10% or your deductible. And so your deductibles all start in January. And so you would still get a bill. It may be higher than normal because you may get the full $462 of your Medicare bill because that portion went to your deductible. So somebody's going to pay your deductible somewhere.
The question was whether or not Friendswood would bill Alvin, Pearland, League City. They will receive the same bill as a Friendswood citizen will.
Fee schedule's the same. Yes.
The fee schedule is the same.
Yes.
And it will go through Emergicon and be treated exactly the same.
So the question is, if Friendswood doesn't have an ambulance available and I have to call Alvin to come take you to the hospital, you will not get double billed. You'll get the bill from Alvin. And we'll provide the service knowing that we can't double bill you anyway.
It's billed by
allowed. It's not legal.
it's billed by the transporting ambulance service.
So the question is, I don't live in the city limits of Friendswood, but I have a mailing address in Friendswood. Right. So are you in Heritage Park? Yes. You are covered by the Forest Bend Volunteer Fire Department for your fire protection, Harris County Sheriff's Department for your police, and CLIMC, Clear Lake Emergency Medical Corps, has a contract for Heritage Park for EMS.
Yeah, for him.
And if they're not available, then they call us. And so we would be right there, very close to you.
I appreciate everybody coming out and spending your evening with us.